Dear viewers, we often hear about development, the kind that boasts of shining highways, record-breaking bridges, mega investments, and towering infrastructure. But is that truly development if mothers are losing their babies before they even turn 1 year old? Let's get honest. Kerala has just made history. In 2023, Kerala's infant mortality rate, the number of babies dying before their first birthday per 1,000 births, fell to just 5. That's right, 5 per 1,000 live births, lower than the United States, 5 times lower than India's average, and shockingly, it's over 3 times lower than the country's financial powerhouse, Maharashtra. In this episode of Honest Take with me, Tejas, we try to figure out how Kerala managed to pull this miracle and why a state like Maharashtra, with abundant resources and funds, still lags behind. But before we move ahead, please subscribe to Lokmat Times if you haven't already and press the bell icon to never miss an update. Let's get one thing straight. Numbers don't lie. Kerala has just made history. Its infant mortality rate fell to 5 per 1,000 live births in 2023. That's the lowest in India and even better than the United States, which stands at 5.6. Maharashtra, by contrast, is at 16. In plain terms, that gap means thousands of children in one state survive while in another they don't. How did Kerala do it? The state didn't have a magic wand. It built a health system brick by brick with a simple philosophy. Healthcare is not a privilege, it's a right. Every infant death is audited. That means when a child dies, a committee investigates what went wrong. Was it birth asphyxia, prematurity, infection, or a referral delay? Then they fix the gap. No sweeping under the carpet. Access is universal. Whether you are in Kochi city, a coastal village in Alapura, or a tribal hamlet in Wayanad, you get the same quality of care. Hospitals aren't just buildings, they are accredited for quality. 16 hospitals in Kerala have National Lakshya certification for maternity excellence. 6 have Muskan recognition for childcare. That's not for show. It means labor rooms are well staffed, delivery protocols are strict, and newborn care is top class. The state expanded neonatal ICUs and newborn nurseries, trained nurses and obstetricians, and rolled out comprehensive newborn screening. Birth defects get picked up early, not after it's too late. Then there is the Hridayam scheme, a public-private initiative for babies with congenital heart diseases. Thousands of surgeries have been done free of cost. Deaths from congenital defects dropped by 41% in the first few years of this program. Imagine that. Thousands of families spared tragedy because the government decided every child's heart deserved a fighting chance. And here is the kicker. Kerala has no rural-urban disparity in infant deaths. That's unheard of in India. In most states, a child's chance of survival depends on whether they are born in a city hospital or a remote tribal village. In Kerala, geography doesn't decide your fate. Now let's take a look at Maharashtra. Yes, the state has special newborn care units, newborn stabilization units, ASHA workers, and kangaroo mother care programs. Yes, Mumbai's big hospitals deliver good results, but step outside the cities and the story changes. Melghat, Amravati. The word itself has become shorthand for child death. Malnutrition, diarrhea, pneumonia, diseases that should have been eradicated decades ago, still claim lives every monsoon. Every few months, headlines scream, 25 children dead in Melghat. Politicians visit, distribute nutrition packets, and vanish. Next year, the story repeats. Palghar, just hours away from Mumbai's glass towers, tribal children die of starvation and preventable illnesses. In 2016, more than 600 children died in 1 year. By 2023, despite crores spent, the tragedy continues. Nandurbar, ambulances don't reach villages in time. Pregnant women walk for hours. Infants die of birth asphyxia or low birth weight because neonatal care is miles away. A twin pregnancy there doesn't mean double joy. It often means double tragedy. Gadchiroli, known more for Naxal violence than for healthcare, but the real violence is silent. Babies die of malaria, pneumonia, diarrhea. Women give birth at home, often without skilled attendants, because the nearest hospital is too far or too hostile. These aren't isolated pockets, they are the symptom of a broken system. Maharashtra has the money, but not the will. It has the policies, but not the follow-through. Kerala's infant mortality fell steadily, 12 in 2015, 7 in 2018, 6 in 2021, 5 in 2023. Consistent progress, sustained reforms. Maharashtra, it moved from 19 in 2018 to 16 in 2023. A decline? Yes. but painfully slow and still nowhere near Kerala's level. Over 7 years, Maharashtra recorded 1,17,000 infant deaths. That's an average of 46 babies dying every single day. Let that sink in. Every day, 2 classrooms worth of infants don't make it to their first birthday. So what did Kerala get right and Maharashtra get wrong? Kerala invested in equity. Maharashtra allowed disparity to grow. Kerala treated every infant death as unacceptable. Maharashtra normalized it. Kerala designed schemes for congenital heart disease, birth defects, and high-risk pregnancies. Maharashtra still struggles with basic antenatal checkups and anemia in mothers. Kerala ensured rural access matched urban. Maharashtra let tribal belts suffer while metros flourished. Maharashtra's leaders love inaugurating big projects, the Samruddhi Mahamarga, the coastal road, new airports. They tweet about FDI and GDP. But when was the last time when a chief minister sat in a Melghat village, asked mothers why their babies died, and demanded accountability from doctors and bureaucrats? When was the last time when a deputy chief minister lost sleep over Palghar's malnutrition deaths? The truth is brutal. Babies don't vote. Tribal mothers don't trend on Twitter, so their pain is invisible. Kerala, in contrast, has civil society pressure, media scrutiny, and a culture where infant deaths spark outrage. That accountability forces governments to act. So what's the way forward? Maharashtra doesn't need to reinvent the wheel. The blueprint exists. Audit every infant death. No more faceless statistics. Treat each case as a failure of the system that must be corrected. Strengthen rural healthcare. More primary health centers, more neonatal ICUs, fair pay for ASHA workers, functioning referral transport. Tackle malnutrition head-on. Monitor ICDS centers, ensure ration schemes reach villages, expand nutrition programs. Invest in maternal care. Anemia, unsafe deliveries, and lack of antenatal checkups are killers. Fix them. Adopt Kerala's models. Accreditation, screening programs, public-private partnerships like Hridayam. If Kerala can do it with fewer resources, Maharashtra has no excuse. Every time a Maharashtra politician brags about an expressway, remember the mothers walking miles with dying infants in tribal belts. Every time they boast about GDP, remember the 46 babies who don't see their first birthday every single day. Development isn't about how fast cars move, it's about whether babies live. Kerala got that right, Maharashtra still doesn't. This is our humble attempt to wake the authorities up. That's all for today on Honest Take with me, Tejas. Until next time, stay sharp, stay curious, and never stop asking tough questions.